Hi, and welcome to all of you that are on the class. The reason I decided to do this class is the symptom form is one of the most important parts of the functional medicine assessment of any client's health journey. So it forms one of the three main forms that I ask all of my clients to fill out. The other two being the health history intake, which is everything that has happened in their health, what medications, what operations, what is their generational kind of history, health history, as well as the timeline, which I've done another masterclass on. And that is also an important aspect of trying to see where somebody has come from, as well as what might be on their timeline that impacts their health currently. And so using the timeline, the health history, as well as the symptoms, I'm able to make a really good picture of this particular person who is struggling with many different health issues. And with all of this information, I'm much easier able to sort out what are the priorities of where this person should be starting. So the reason the symptom questionnaire is so useful is because it kind of breaks the body down into systems and gives me quite a good snapshot of what systems are being affected, and then know where the work is for each individual client. So what I'm going to be going through is the symptom questionnaire. So most of you have filled out this form, and they have received their scores from me. So just briefly, I did an Excel spreadsheet of all the clients that have worked with me, a low and a high score, as well as the average of them all. And that works out to be about 56 on the score sheet. The lowest being somebody who actually had a diagnosis of diabetes, and she scored herself only at 17. So it is kind of dependent on how this person sees their symptoms, or whether they also have a body awareness, or whether they're really only focused on one symptom that they're trying to get rid of, as to maybe how they score themselves on the symptom questionnaire. But I've had clients that score over 100 as well. And so there is quite a large gap. I would say if you're sitting anywhere above the 45-50 range, that there is probably a good amount of work that you can do to improve your symptoms. If you're on the lower end, so say around the 20-25 range, depending on how serious you feel these symptoms are, there will be probably a more individualized. I always start with diet. It tends to be the first place that most people haven't thought of, or if they have, then we move on to the next phase, which might be gut, might be something else, depending on the person. So right, so the symptom questionnaire, if you have filled out the form, you can go to the link and go through it yourselves, but I've got it in front of me, and I'm going to go through each of the systems as I see them and what pops up to me. That's the important thing I want to convey, is what pops up to me when I see certain symptoms showing in these different categories. So we start with the head, and what I see common is headaches and maybe a little bit of insomnia in this category. So they're slightly different in that headaches I usually associate with some kind of either inflammation, a food sensitivity, or some kind of nutrient deficiency. So it is a common one. Obviously, hydration could be quite a large factor there as well. But when I'm looking at headaches, there are a number of factors that I'm thinking of. Insomnia, we have a sleep section and an energy section as well, but insomnia, I'm often connecting as well to gut health, because I'll go into that later. A lot of our sleep hormones are driven by good gut health. Nose section, the first thing I'm thinking of when I see a lot of 3s and 4s here is food sensitivities, as well as possible immune system infection kind of picture. One of the most common things, if we are looking at nose and stuffy nose and sinus problems, if you haven't changed your diet, if you haven't gone off dairy, that would be like the first place that I would recommend you start. Sneezing attacks, obviously hay fever, seasonal allergies, these kinds of things are all related to the immune system. And when I'm thinking immune system, I'm thinking gut. Okay. Next section, again, very strongly related to gut, is the skin. So what we say in functional medicine is whatever you're seeing on your skin is a mirror of what your gut looks like. And so whenever I see any symptom of skin, and I support quite a lot of people with hives, the gut always has to come into play. And so here again, acne, inflammation, gut health, food sensitivities, hives, definitely food issues, whether it's food sensitivities or food intolerances, usually it's food sensitivities, as well as gut health. Dry skin and eczema, again, gut health very strongly. Flushing or hot flashes, which is more and more hormonal, often a menopausal symptom. I'm thinking again gut health, and I'll speak about that connection later. But things like feeling cold and hair loss, there are connections there to thyroid and energy, as well as toxins and stress, possibly, or nutrient deficiencies, more specifically, I'd say things like iron, which are necessary for good growth, hair growth, as well as feeling cold. So blood health, cellular health is what I'm thinking. Good. So moving on to the next section, which is mouth and throat. So if we think about the mouth and the throat, it is just really the first extension of our gut. And our gut is one of our primary barriers for our immune function. So the mucosal lining in our mouth and in our throat is one of the first areas that our immune system starts to react to things. So if I'm seeing a lot of things in the mouth and throat, I'm thinking again, immune system, barrier function, how is the mucosal lining functioning? Why is it being affected? Canker sores is one that I see quite commonly, and that again is related to the immune system. We do know that when we have a depressed or suppressed immune system, that we can come out in things like canker sores. Heart health, a lot of skipped beats and rapid pounding beats. These two I connect a lot with hormone, menopausal symptoms as well. So if you are of the age where it's a menopausal thing and we're thinking hormone imbalances, then I'm going back again to gut health. But what also impacts the rate of the heartbeat is the adrenal and the thyroid. So anything to do with hormonal health has a lot also to do with stress, our stress management, as well as maybe even detoxification. So hormones in general need to be manufactured and detoxified. And so if there is an excess of hormone waste that is hanging around, this can also cause some hormonal symptoms. And this is where gut health and detoxification issues come into play. Lungs, again, another extension of our immune system, this time opening itself up to environmental allergens, etc. So if you're struggling with chest congestion, asthma, bronchitis, that kind of thing, I'm thinking that again, it's an immune response coming out of your lungs, and they're responding to something. So either you have some form of immune deficiency due to nutrient depletion, or there's something else that keeps on attacking your immune system and your immune system is struggling. So that's where I go into what could be bothering the immune system, and that takes a little bit more investigative work. Energy and sleep. This is a very common place that a lot of people have lots of symptoms, and that's because it's so multifactorial. So when we're thinking about energy, I'm always thinking about cellular health. So how well are those little mitochondria, which are energy powerhouses, how are they working? Are they getting enough nutrients, for one? And again, we come down to gut and digestion. So if you're eating well, are you bringing on the nutrients? I'm thinking about your immune system. Is your immune system being bombarded, and that's why you're feeling tired, worn out, etc. Your immune system's on high alert all the time, so it's going all the time, and therefore you're tired. And again, hormonal, is your thyroid affected? And this is your engine. How is your thyroid being affected? Is it a case of nutrients? Is it a case of stress and toxins affecting your thyroid? So there are many different factors I'm thinking about when I see energy and sleep show up quite heavily. And this is what requires quite a lot of partnership with clients into the investigative work. Where could it be? Is it more an immune thing? Is it a gut? Well, immune and gut are very closely linked. I'll explain that when I get to the gut. But are there factors like toxins in your environment? What is your stress, emotional and physical stress? There could be many different factors of stress involved here. Things like insomnia, which I mentioned earlier in the head section. Sleep is affected always by our hormones, and our hormone melatonin, which is our sleep hormone, is made from serotonin, which is 90% produced in the gut. And so that's the strong connection to gut and sleep. If you're struggling with irregular sleep, waking up all the time, or struggling to fall asleep, depending on which one, it could be also an adrenal and thyroid, an adrenal or cortisol issue. So usually when we fall asleep, cortisol comes down and should stay low, but sometimes cortisol gets spiked, maybe because of blood sugar issues, and that might wake us up. Things that also might wake us up in the middle of the night is issues with the liver and detoxification. And so that could also be a factor that we would need to consider. But in general, things that would help is a regular circadian rhythm. So even if you're struggling in this area, there's a lot you can do with just getting a regular sleep routine. Mind and brain. So a lot of cognitive issues, even things like Parkinson's, dementia, very much related to inflammation in the brain, which may be coming from nutrient deficiencies, as well as gut health. So for those of you who don't know, there is a very strong connection between the brain and the gut. And in fact, the gut is called the second brain. And there are lots of neurons and lots of communication going from the gut to the brain. So if there's inflammation in the gut, there's very likely some form of inflammation going back to the brain as well. And so if you're struggling with cognitive issues, memory, brain fog, we need to also, again, be assessing whether there's inflammation in the gut. But I've also seen brain fog being downstream to food sensitivities. So that might be an area that I'd be looking in as well. Mood, again, so tightly linked to brain health, mood health, hormonal and brain-gut axis issues, but also especially the kind of the mood swings that we women kind of are burdened with, let's say. Estrogen being one of the main hormones that tend to fluctuate over our hormonal periods, that detoxification, again, is an issue, because if we have problems detoxifying this hormonal waste will get recirculated and cause an imbalance in our hormones, causing things like mood swings. But more specifically, anxiety and depression would be, again, related to the hormone serotonin. So it's serotonin, again, 90% is produced in the gut. We need to be thinking about how is gut health doing. So if you scored quite highly there, that's one thing that I'd be talking about. Digestion. Okay, so most of the work that I do with my clients is in the digestive area, because it's so connected to so many of these systems, whether it be your immune system or your hormonal system or your brain and cognitive areas. Addressing the gut addresses so many of the other knock-on areas. And so that's why, even if you're not experiencing gut and digestive issues, just having any of those other symptoms, whether it be hormonal, immune nutrient deficiencies, I'm always going to come back to the gut, because this is where we absorb our nutrients. This is where a lot of the things are going to happen and get sent out to the rest of the body. Okay, so if you have symptoms here, it's very clear that you have gut work to do. And the kind of work that we're doing in the digestive tract is top down. How are you chewing your food? How are you breaking it down in the stomach? How are you absorbing it in your intestines? Is there a case of leaky gut? Does some work need to be done in terms of healing leaky gut, as well as is there obviously bacterial imbalances, etc., that might be affecting the balance in the microbiome? Okay, so we move on to joints and muscle, bone. So a lot of the symptoms here I see are joint and muscle pain, arthritis, that kind of thing. These are all underlying symptoms of inflammation. And when I see inflammation, I think leaky gut. Again, sorry, we come back to the gut again, simply because what's happening in the gut comes through the intestinal lining and starts to cause havoc on the other side, which is into our bloodstream, and our bloodstream goes everywhere into our joints, and that's where they start to end up causing havoc in areas where there's low circulation. Certain undigested proteins end up there, antibodies are responding. So inflammation is a very strong connection to leaky gut and poor nutrient absorption, because what we need to calm inflammation, so inflammation is a normal bodily response, but if we're unable to quell the inflammation, it means that we don't have the nutrients to quell the inflammation. And so again, we come back to what is coming in. Are you taking in enough nutrients, and how are you bringing them on? Are you absorbing them? Again, a gut issue. One of the things that a lot of people don't realize is that this restless legs syndrome is commonly related to a deficiency in iron as well. Okay, so right. Only 2 more areas, and then we can head on to questions. Weight. I always talk about weight as simply a symptom that is telling us of an imbalance in the body. So a lot of people are trying to manage their weight, whereas they should be looking at all of the other different symptoms that could be pointing to other imbalances in the body. And very, very often weight is the last thing to budge, because it is your body's way of saying, I need to stay safe. It is, the primal way our body has kept us going for so many years, is the survival instinct to store fat when things out there don't look safe at all. And so if your body is getting signals that there's stress, whether it be physical or emotional, and I mean physical as in your body is under threat, it's seeing infections, it's seeing immune system alert, that's putting it under physical stress. And so that's going to hinder any kind of weight loss efforts that you may be trying. And that's why I never talk about weight as a primary thing. I always talk about, let's see what imbalances can we resolve, addressing inflammation, addressing nutrient imbalances, addressing the gut, and then the weight will come off on its own, because then the body feels, okay, things are getting resolved. I can now let go of the weight. But there are some, emotional aspects, compulsive eating, etc. That could be emotions for one, but it could also be your body talking to you saying, this is absolute nutrient deficiencies. I'm craving something because I'm not getting it through my food. And so, I'm not absorbing it in the food that I'm eating. All right. And then lastly, it's just largely a woman or a female broad catch area. Frequent urination usually points to blood sugar issues, frequent illness, to immune system dysfunction, genital itch, etc., is going to be linked to kinds of infections, bacteria, fungal, fibroids, whether it be breast or uterine, it's going to be connected to estrogen imbalances or hormone imbalances. And you might be surprised, but low libido and sexual dysfunction often related to food in general. So just eating the right foods can even rebalance that. Good. So I hope that that was informative. I know that a lot of people filled out the forms, and I've had quite a spectrum of symptoms going from below 20 or slightly below 20 to over 120. So quite a wide spectrum. If you have symptoms in the hundreds, please book a call with me, because I do think that there's something that you can be doing. Even if I can just point you in the right direction as where to start, that would be a great thing. But not doing anything is not a solution. And so I really urge you to take upon the opportunity to have a free call with me and get some guidance on that. But anywhere between 50 and 70, if you want to have a call with me as well to discuss your specific symptoms, feel free to book a call. I'll put a link in the YouTube comments where you can book a call with me and we can discuss your personal journey. But what I do recommend for a lot of people, if you have seen your symptoms and you feel kind of overwhelmed, that possibly considering what I call the quick start, and that's the me reviewing your timeline, your symptoms, and your health history. So for those of you who have filled out the symptom questionnaire already, I'd be happy to offer you a discounted rate on the quick start. So if you're interested, just message me and I will tell you about that offer. And then, yeah, we can discuss how we can take you further. I'm going to stop the recording now and open up to questions.